We are not going to have all these instruments. We're just having these four. All right, this is all we're going to have with this. Very good. Okay, so we're going to start off with our probing. Okay, so what we want to do is, so here is I'm going to refer to number 9, and like I said, if you guys are right-handed operators, pick number 9. If we're asking you to do something on the anterior with the with one of our, well, we probably won't anyway. But if we're asking you to do the premolars, pick the upper left. It's much easier for right-handed operator. Okay. So the root of number 9. Can you see? Okay. Yeah. Okay. So the root of number 9 goes like this and like this. Okay. So we're going to keep the probe parallel to the root of the tooth, which means I'm not going to be going in like this. I'm going to be going in like this. Okay. So I'm going to show you above the gum, just so you can see. I'm going to start here. I'm going to go in and I'm going to slide the tip down the tooth surface. Okay. And I'm going to stop here. You're going to stop, take a breath, so your instructor knows that you're, you know, taking a measurement. And then I call it bringing my fingernails up over the tooth. As soon as you cross the midline, you got to start bringing your hand up so you can slide it down the distal. Okay. You don't want it. It's not like this. It's just bringing your fingernails up over top of the teeth. Okay. So let me show you how you're going to do this. You know, underneath the gum line. This is the way you would do it for the practice. You're going to start here, and you're going to very slowly walk around. You're going to stop here, and you can notice the probe is not laying flat. That's going to hurt the patient. It's kind of subtly pointing in towards the tooth. As soon as I'm in the midline, I'm going to start. I stop, take a breath. The instructor knows I'm taking a reading. Then I'm going to start bringing my fingernails up over the teeth, and I'm doing my distal reading here, all the way in between the two teeth. The most important area to probe is in between the two teeth. Okay, so that's it. So remember, we're going to go very slow when we're probing, and we're going to stop at the midline here, okay? And we're going to really shift our hand up. All right, so that's probing. CEJ detection is kind of like probing, except, hey, Dan, how are you? So probing is, CEJ detection is kind of like the probing, except we do it in a different way. So we only do 3 spots, 1, 2, 3. We don't walk in between. We're not looking for that, and that'll give you some points off. So let's say we're going to do the CEJ detection here. We're going to go in as if we're probing. We open the probe up. The reason why we're opening the probe up is we want the tip to find out where does the crown meet the root. So you're opening it up, then you're wiggling up and down, and it's an up and down motion because you want to know where does that the crown meet the root. Okay, so you're going to open up and then you're going to lay it flat. Okay, you're going to take the tooth out, then you're going and take the probe out, and then you're going to go out. You're going to take it, no teeth out. We're going to go into our midline reading. We're going to go in as if we're probing. We're going to open the probe up. We're going to wiggle up and down, and we're going to lay flat. We're going to do the distal. We're just going to go in, open up, wiggle up and down, and lay it flat. Okay, so so we're looking for those movements of going in like you're probing, opening up, wiggle up and down, and lay it flat. All right. Okay, let's talk about our 204. Our 204 is our only pointy instrument, and we are not going to go subgingivally with this. All right, important that you guys know where the terminal shank is. The terminal shank is right here. It's the last bit of shank holding the cutting edge on, okay? So in order to, I'm going to refer to number 9, and we can use this in between any tooth, posterior or anterior, but I'm going to show you guys how to figure out which end to use. Okay, so my terminal shank, I'm going to line up my terminal, we're working on number 9 here, I'm going to line up the terminal shank with the mesial of whatever tooth I'm working on. Line up your terminal shank so it's parallel to the mesial surface of that tooth. Okay, if it works nicely, that's the correct end to use. So this would be the correct end. If I'm not sure, if I wanted to get my terminal shank parallel, I'd have to hold my hand way over there. So now I do know that this is the correct end to use. So my first step is my terminal shank is parallel. My second step is I'm going to roll the tip with my fingers. I'm just going to roll the tip to adapt the tip. This is the most important step of all, because if your tip isn't properly adapted, then you're probably hurting the patient. So terminal shank is parallel. Second step, I'm rolling the tip. Then I'm doing my short overlapping strokes, okay? Doing your overlapping strokes has nothing to do with rolling the tip. Rolling the tip is just to adapt the tip. So this is all you have to do. Go in, roll the tip, a little bit up and down, and that's it. You can go right to the mesial of 8 if you want, except you have to roll the tip so it's pointing towards mesial number 8. If you go to the distal, terminal shank parallel, roll the tip tight, short overlapping stroke. So it's all about having that tip properly adapted. You should be able to feel the tip kind of grabbing the tooth, and you don't want like a 90-degree angle, but you want it really kind of pretty much pointing towards the tooth, the surface you're working on. Okay, and if I say to you, all right, show me the lingual, I'm looking for you knowing that you have to flip the instrument to use it. I might not be able to really watch you do the lingual, but I want to know that you know to flip that instrument, okay? So that's our 204. We're not going subgingivally at all with that. Now we're going on to our 1314, and it'll say SC, ooh, where is it? Oh, there, upside down. It'll say SC 1314, kind of hard to read, but that's what it says. Here's my terminal shank. Important, you guys know where that is. The terminal shank is the last bit of shank before the working end. Here's my working end, or my cutting edge. Okay, so I'm going to pretend like number 9 is a premolar. We're going to basically use this on premolars back to the molars, okay? So if in the competency, if we ask you to do premolars right or left, you go to the left if you're right-handed, okay? So what we're going to do with this instrument, it's kind of a long, it takes a long time to do this instrument. So remember, this is the instrument that you have to do a lot of work with. We're going to start at our distal. Terminal shank. Well, first I'm going to figure out which end to use. I'm going to hold this up. This wraps nicely into the mesial. Yes, this is the right end. If I'm not sure, I'll try to get my terminal shank. I have to hold my hand way over here to get my terminal shank parallel, okay? We're going to start at the distal. Terminal shank parallel. We're going to roll the tip so the tip is really tight. Short overlapping strokes. Okay, that's for the distal. We're taking the instrument out. It's a whole new stroke now. Okay, we're starting at the distal buccal line angle, and we're very slowly, I call it the rock and roll. We're very slowly doing the wrist rock, and then we're going to roll at the same time. It takes a lot of practice to do this, and we're going to end just like this. Can you guys see how the tip is pointing really tightly into the tooth? Okay, so like I said before, this is a long, it takes a lot of work with this instrument. Do the distal, take it out, and then we start walking forward into the mesial. If I say, okay, show me the lingual, you're going to know to flip it around, and that's it.
And so we shouldn't, for the practical, just keep out the SCs. Anything with the G, Grace out.
Gracie, you shouldn't bring any of that, and you don't need to bring your this is a SC, it's a 4R, 4L. You don't need that. Just bring these 4 instruments. All right. Okay.
Can you show us on the mandible?
Oh, sure, absolutely.
The demonstration.
Okay, so we're going to start with our 204, and okay, so let's say we're going to do this tooth right here. Oh,
they can ask us to do any tooth.
Yeah, but I don't think, I mean, we've never ever in our life done lower, so maybe, no, we would not do that. We don't want you guys to fail. It's hard. It's always
interior. Or?
Yeah, I mean, I can't promise you, but I've never, in all the years I've been working here, we've never done that, and I wouldn't want to do it because it's a little harder for you guys to do this. But anyway, okay, so I'm going to work on this tooth right here. I'm going to hold up my terminal shank so it's parallel to the mesial. This end will work nicely. That's the end I'm going to use. But for me to get that, I'd have to hold my hand way over here. So I'm just going to go in very simple. Same as above. Terminal shank is parallel. I roll the tip. The tip is pointing tight into the mesial surface. Short overlapping strokes. If I do the distal, terminal shank is parallel. The tip is pointing tight. Short overlapping strokes. If I want to do the lingual, I flip the instrument around. Okay, but like I said, I've never ever seen us ever ask for it to do anything on the lower. Well, we could ask for the lower premolars, but I don't think so. We didn't do that before, so I don't know. I think we'll probably ask you to do premolar. I can't guarantee, but I think we might. Yeah, it's easier for us to see. It's hard for us to see down here. And if you have a choice, do not do a lower right buccal. That's hard for a right-handed operator. If you are going to ever have to do that, you bring yourself all the way around like this. Oh, well, if you can get around there. And you sit like this, you know, straight out and go in. That's the best way. Oh, I think I've knocked everything over.
If they ask us to do the lingual, would we do it using the mirror?
You could, yeah. Yeah. I mean, what I do is I say, okay, show me the lingual, and I watch for you to flip it around. Unless you really mess up on the buccal and I feel like I need to see a little bit more, I'll probably watch a little more on the lingual. But otherwise, I just am looking for you flipping your instrument so that you know that, you need to flip the instrument. Do the lingual.